interpreting association or network, interpreting and translation, is, you know, what opportunities we have, not only for professional development, but for business development and the well-being of our community. And so those are the topics that we've selected. The last quarterly meeting, we had the Department of Public Health Language Access Service Provider Total Language present how to join the organization, what the requirements are, what the remuneration was, and just basically an overview of that organization. And so now we're going to tell you about how you can become an eligible Medicaid provider and how much you can expect to be reimbursed. So it's pretty simple in terms of the requirements. There's an application process. It's an online application, and you just have to submit some type of proof of formal training in interpretation and medical terminology. That goes to the Department of Healthcare Financing, which is a subgroup of the third party that manages Medicaid for the state, and they approve it. What I can tell you about our organization as a provider, our organization and our team members have all either taken the Bridging the Gap training, which has been offered here locally, or the community interpreter training, which is something we'll talk about a little bit more if you're not familiar with it. We understand that there are countless other trainings. The important element about any training, and that we hope Medicaid wasn't able to give me any specific information about how they evaluate the training process, is that there should be a language assessment as part of the training curricula. So do y'all know what I mean by a language assessment? I'm hearing silence.
Was it basically a test on the proficiency?
That's it, yeah. So there are numerous providers of these types of assessments. They can be telephonic, where you actually speak on the phone with someone who kind of just asks you questions in your target language, typically. What we recently used and we found was really very effective is the same language assessment that the federal government uses to assess bilingual capabilities. And what's interesting is, depending on the training course, some only ask you to demonstrate proficiency in the target language, so whatever your second language is. The community interpreter requires that you show proficiency in both languages unless you have a master's level degree in either language. So you take both tests. And these are now computerized online tests, makes it fairly simple to use. Our experience, we had about 13 people take the test. We only had one person who scored below an acceptable level, if that is of any interest. I don't know how that worked out, Lillian, for your community interpreter courses, if you have those results. So that's it. You have to have some kind of training and submit it to the state. Any questions about that?
No, we're good.
All right, cool. It's pretty simple. It's straightforward stuff. So then you have to enroll as a provider within the Medicaid system, Wyoming. It's also called Equality Care. So they're interchangeable. Wyoming Medicaid equals Wyoming Equality Care. They're both the same thing. You will sign a provider agreement. It's valid for up to 5 years. It has to be renewed after 5 years. The application fee depends on how you submit your organization name. Are you a sole proprietorship? Are you an LLC? you know, everyone, or interpretation services are considered professional services. The application fee currently for 122, so I can't tell you what it would be for you, was $500, but it's an organization. So, and again, it's valid for 5 years. All you have to do is go online, and I've included a link to the enrollment application. And, you know, it's going to ask basic information that you're accustomed to: name of the organization, physical address, tax ID numbers, things along those lines. You'll receive a welcome letter if you're approved, and if you're not approved, they're going to tell you why you're not approved, and you will have to follow up on that. Currently, and again, talking about this, only approved providers can submit claims and be reimbursed for interpretation services. And guys, this is it. This is the list for the state of Wyoming. Kind of sad, right? Two people in Cheyenne, a couple of big companies in Portland and Washington, and an individual in Utah, and then El Puente, or the organization here in Jackson. So lots of opportunity for anyone who's interested in going out there and building some business.
Do you know what they do? Like, for example, here in Casper, that there's none? Do they do it over the phone?
I have no information as to what kind of interpretation services are being provided in Casper.
Or in other
I don't
places?
know if that's,
in just in any place that they don't have any interpreter, like the list is really short.
Yeah, so here's, and you know, this is, I am by no means an expert, and Lillian will definitely correct me. So, you know, we've all heard of Title VI of the Civil Rights Act that requires recipients of federal funds to remove language access barriers or barriers to access, right? And of which limited English proficiency is considered a barrier. So it is the responsibility of the healthcare provider to provide services. Whether they do or not, nobody's really checking up on them to see if they do. Different providers, so this is where it's important, this kind of approved services, so now your question is good here. There are certain providers or types of services, let's say, that from the Wyoming Medicaid perspective, within their pricing and within their processes, they should already have interpretation there. So all hospital services, right, either inpatient or outpatient, they should have in place, right? The assumption is everybody receives federal funds, therefore they should have some sort of plan in place and in use for interpretation. Whether they do or not, I don't know. So I don't know. How many hospitals are there in Casper?
One.
One. And do you know what they do when someone comes in who doesn't speak English?
They use over the phone.
They use over the phone. Okay. Yeah. All right. But then the private providers, okay, so doctor's offices, an urgent care clinic, all of those, if they receive Medicaid, if they accept Medicaid, they are expected to provide these interpretation services as well.
Yeah.
The difference is that the provider of the interpretation services can request reimbursement directly from Medicaid. The doctor can't. The doctor's office, unless they sign up as an authorized provider, even if they have, let's say, bilingual staff, whatever the case may be, they can't request reimbursement from Medicaid. So your market there is all the private providers. Get the knowledge out, let them know, and work with them. Does that make sense? I don't know if I'm...
Yeah.
Well, okay, so Cindy, I have a question.
Yes.
how would that work then? So you're saying you would bill the private provider?
No, you bill Medicaid.
Okay. Which we'll learn more
You bill
about.
Medicaid. Yeah, so covered services right here, in-person and remote interpretation services, okay? And you can only bill for time spent with the client in conjunction with the Medicaid healthcare services delivered by the different providers. So what that means is if you're helping set appointments up for people, can't bill that. Can't do that part.
Okay.
But the time that you're in the office with the physician, or let's say if the three of you are on the phone making an appointment, right?
Yes.
So if you're doing a telephonic interpretation, those are billable.
Okay.
But everybody has to be together at the same time. It can't be like the doctor left you a message and said, call Maria Alvarez and, you know, we need to deliver her lab results. No, it has to be Maria Alvarez is on the phone with you and with the doctor, and it all takes place at the same time.
Okay.
Okay. So the non-covered services, and that's this long list of things, right? So all hospital services are not covered, different types of facilities. Down at the bottom, that abbreviation, the ALAN program, that's a special Medicaid program for people who don't qualify for Medicaid in an emergency situation due to the lack of a social security number or a legal status in the United States.
Okay.
Okay, so those particular people you can't bill for that. And what happens is Medicaid has all these different programs. And all of them have different numbering and codes, and you can always check. I don't think in the state of Wyoming we have a lot of ALAN applications. I don't even think people know that those are available, right? So basically what it means is somebody walks into an emergency room and needs urgent, immediate assistance, doesn't have health insurance, goes through the financial assistance piece at the hospital, and you would hope that the hospital would say, hey, let's apply for emergency Medicaid for you and see what happens. Our experience here in Jackson is the hospital doesn't even know that these services are available. So we're just starting to learn more about it to help people. What ends up happening to those people is they end up setting up a payment plan with the hospital, basically, to pay for their expenses. I mean, you know, anything that you can think of.
I have a question, Cindy. So on the second one, intermediate care facility with persons with intellectual disability, would that be an example of saying a service with Magic City of Cheyenne?
I'm not familiar what Magic City does. Do you want to tell me?
Yes, they provide services with people with different sorts of disabilities, and they have training on safe checking and how to live at home, on the job training. And so there's a whole range of services that they provide.
Yeah, so those would not be covered by Medicaid because the institution itself should have some sort of a language access plan in place.
Okay.
That doesn't mean that it's not an opportunity for you to go to them and say, hey, I can be your face-to-face interpreter for this instead of telephonic, if they're using telephonic. Or are you even doing this? Do you have interpreters in place? Are you using family members? No, you know, I am a professional interpreter. The same thing for the hospital. I mean, the hospital may choose to use telephonic or video. That can be extremely hampering in many situations. One, I don't know, the internet goes down here all the time. It's a nightmare. And so the video doesn't work very well. You can't use video in the radiology department, right?
Mm-hmm.
So different things like that. So these organizations are still potential clientele from an interpreting business perspective. you know, it's just kind of getting the word out there that there are people available who can assist them from a face-to-face perspective versus just the telephonic and video.
Okay.
Cool. Onward and upward. So the fee schedule. In November 1st, 2016, the fee schedule was changed. It went down. It was previously 11. It's actually gone down over the last 10 years from what I've been able to study. I mean, at one point in 2006, it was $20 per 15-minute increment. And then it went to $11.25 per 15-minute increment. And now the fee is $10.88 per 15 minutes. So any encounter that's over 8 minutes long, so you have to kind of beat the 7, you know, the halfway point, is considered 1 unit. So between 8 and 15, 8 and 22, 8 and 22 minutes is considered 1 unit. 23 to 37 is considered 2. You guys get the gist of it? And the billing amount is $10.88 then per unit. That equates to $43.52 an hour. And the maximum amount that you can bill per encounter or per engagement is 6 units. So if the appointment is a 2-hour appointment, you know, Medicaid will only reimburse an hour and a half worth of the appointment. Okay. And I'll be happy to in the future if it's something that everyone's interested in. As I say, we're becoming super experts here because we have reevaluated our entire process, and we're learning more and more every day, little secrets, little things to make it easier. So tips and tricks on how to process your claims. The claims themselves, Medicaid has an online service, and it's a pretty simple to fill out the claim online. It's electronic. You set yourself up as a vendor with the state of Wyoming through this process. And I mean, you can either receive a check, it can be direct deposited to your account. It's fairly simple, and there's an electronic process, and the turnaround time is really pretty good. We've seen that when we submit clean claims, that the payment usually takes about a week to 10 days, which is pretty nice. All right. So what I've got for you here is what you'll find is there's 800 numbers where you go into a call center for providers. Wonderful group of people. They're going to refer you, though, quite a bit to all the manuals, as you know, right? Our typical support. But that's support centers in Cheyenne, so you'll have a good crew of people. You'll make friends with them quickly as you go through the process. The important manuals that you want to be interested in is the entire Medicaid provider manual for the state of Wyoming. It was actually just updated in January 2017, so we've provided a link to that document. You'll go into the provider portal for the application process, and again, tons of really good information. I've gone ahead and added the sections that are important within that huge provider manual to help you. So chapter 3 is what we just kind of went over, how to become a provider. Chapter 21 is all the information that's currently available regarding interpretation services. You'll find it to be pretty ambiguous, but better than nothing. The other thing that's included in chapter 21 that you may find of interest is kind of the step-by-step that you might want to use with a medical provider. So how to establish the process with a doctor's office, what information they need to give you to set up the appointment. You might find that helpful. the section 21.6 on what records to retain. So you need to have the name of the client, Medicaid number, their group ID number or ID number associated with Medicaid, a start and a stop time for the interpretation services. That's it. That's basically it. That Medicaid requires you to keep those records, and you need to keep those records for 6 years. You can keep them electronically, keep them on paper. Many organizations ask the physician or the medical provider to sign and confirm that they were there. It's up to you. And then you can file claims for up to 1 year, so 12 months, 365 days. And there is an exception process as well. So, but I have all of you. Any questions?
Yes, Cindy. So asking the provider to sign, is there a form, or what would you recommend?
I would recommend, yes, together a little form that, you know, the client, the start and the, you know, and, you know, validation.
Okay.
Records.
So make up your own form.
Audit. Yeah.
Okay.
It's not be an email, however you develop your relationship with your clients. It's not required for the Medicaid record keeping.
Right.
They only want to know who you were with, where you were, obviously.
Mm-hmm.
Time that you spent there.
Okay.
Yeah. Yeah, it's not too tough. We just need more providers out there, and we need to get the word out. Patient providers.
I have a question too.
Sure.
Maybe this one, I don't know if you can answer it or not, but I don't have the formal training. I was not able to take that training last year here when it was provided in Casper. I had vacation planned, so unfortunately I was not here. So I was wondering if there's anything planned for any more training this year.
You know, that's an excellent question, and that leads us right up to the next slide. There's nothing a presenter likes more than when that happens, you know? So I'm saying thank you on behalf of Lillian. And Lillian, why don't you tell Nora and Anna about your plans for the community interpreter?
Okay, we have a training set in Casper on May 21st through the 25th. And we are still, you know, let's just save the dates for right now. We do have a space that's been tentatively, so we'll be having that at the Oil and Gas Commission there in Casper. So we have that space reserved. So we're just still working on next steps will be how are we going to get the scholarships out. You know, those type of things. We have to see how much money, you know, are available for scholarships and how are we going to distribute those to the people that apply.
You
so
say May 24th?
The 21st through the 25th. It's the last week in May.
Yeah. Can I ask why you guys are doing this in May again?
Well, we looked at what between the college and dates. I worked with Casper College, and they said that week is the best week because the college closed.
But it's